70, that was great. Thank you. I'd like both speakers for the oral sensory health session to come up and field some questions, if they'd like. Dr. Rawson and Pappas. And when you come up to the mic, please state your name and where you're from. I'll start off. I just saw something in one of your later slides from Ann Haynes. I think you had a negative wine years as a, I don't know if you remember, what was that?
From our, it was only slightly.
Could you push the, thank you.
Yes, drinking wine was only slightly positive to make you live a little bit longer.
Okay, that's what that was. Okay, thank you. I didn't know if it was enhancing salivary function.
No, this was based on the NSS study that
NSF.
we did hazard analysis, and we're not pushing that too much because it was sort of a funny finding.
Questions?
Mary Worstel with the HHS Office on Women's Health, and this is an area of particular interest in our work in older women because it's such a huge public health gap area. There just isn't much, and there isn't very much about nutritional health and oral health, and I was just speaking at the National Administration on Aging at their annual meeting. And there was a session on nutrition, and they were talking about there just isn't enough out there about, and people are not actively relating oral health and nutritional health. And so I'm really very grateful that you're addressing that here. The other aspect of this in our work, 2 points. One is that, and in just in observations in assisted living and facilities, at the mealtime, people with bad oral health and their pain, they're constantly covering their mouth. They're embarrassed. And there are people who simply won't go down to eat because of their poor oral health. So that's direct or indirect to this whole issue of nutritional well-being, because they just won't eat. But it also relates to their isolation and depression, which also affects their nutritional status. And so I think that that's really important to state. The other thing that we learned is in interviewing healthcare workers in nursing home settings, they were very clear, and they repeated several times, they would rather change a bedpan than to clean someone's dentures. And so they just do not address this in the patients. And I know that there's been some talk about when healthcare workers, when they are trained in how to address oral health in the with patients, and also some that have some, may have cognitive impairment, and how to do that in someone with cognitive impairment. When they approach a person and they become combative, and they are then treated with antipsychotics, instead of someone thinking maybe they are in such pain that by approaching their mouth. So all of this plays into this. So I really want to thank you for including this, and anything else that we can do to help raise the awareness of this, because it is so important, we will do. Thank you.
Thank you.
Would you like to comment?
Yes. Early on, we had examined people in 28 nursing homes and found that people had severe dental problems 20 years ago. And what is bothering me now is that I'm hearing from my colleagues that nothing has changed. And one of the things that we're trying to do is include oral health in the nursing curriculum, so that if the nurses know about it and can look in the mouth and do an inspection and find problems, they can address it and send it the person for care, because 30% of the people I looked at were in severe pain because of some dental issue. And we're getting more and more people going into facilities with teeth now. In the old days, they used to take the denture away and that solved the problem, and they put them on puree. And talk about depression. If I had to eat puree food every day, I would not want to go on living. I mean, that is a sad thing. And also with dry mouth, taste is really affected with medications. With our Sjogren's patients, it's a huge issue.
Yeah, that absolutely. And also, there are also taste buds on the roof of the mouth, on the palate, and in the epiglottis, and any dentures are just blocking that. In addition to the mastication and the release of aromas into the retronasal pathway. Another point I just wanted to comment quickly with respect to radiation. The taste bud is also a regenerative epithelium, and radiation, oral radiation, destroys the taste cells, and it can take months and months and months for those tissues to regenerate. We've, in the clinic at Monell at Jefferson, we would work with patients, and they would rather starve to death because food, if it's less common to lose your sense of taste, but if you do from something like this, especially radiation where you really need calories, you really need to eat, getting enough food, and there was almost nothing we could do to convince them, no matter how much they knew they needed to eat, to get them to convince them that this was food if they couldn't experience the taste of it.
It's been a huge problem with my radiation patients.
Next question.
Hi, thank you both. Hadia Green Guerrero from American Physical Therapy Association. I had two questions. One was, with your comment about the risk and mortality links to wisdom teeth, so do you now recommend that we not pull out these children's teeth when they are kids? And the second question is, with respect to the people who died who had the 23 teeth versus not 23 teeth, how significant was it that they were their molars or their chewing for mastication teeth?
So I think the first part was one of my slides. From the NHANES data, the wisdom teeth removal was a risk factor for olfactory loss, which I think that's just an epidemiological observation. There could be a lot of reasons for that. I certainly think there's other reasons for needing your wisdom teeth removed. I don't think I would do it if I didn't need to do it, but.
And 80% of us need to remove them, so.
Right.
It has to do with damage that's done by going into the sinus if it's impacted, and it's rare. It's not super common, but yes, it can happen. It's more likely to happen with sinus surgery. I've had a lot of patients who've had sinus surgery and then come back and they can't smell, and I do all the taste testing, and the taste is there, but the smell is gone, and they're having issues.
Johanna.
These were fascinating presentations, and just 2 points. One is there are a sizable number of people whom I've seen clinically who are they've had head and neck cancer and they're supposedly cured, but they have basically no taste. And as a result of that, they subsist basically on Susticale or some oral nutrition supplement. And it's really very sad. But the bigger issue is, with all of the changes you've pointed out with drugs, with aging, with disease, I know Susan Shipman years ago tried to do some stuff with, I think it was with Howard Johnson's, where you put packets of food or spices and things to try to heighten the taste and make these frozen dinners taste better. And I don't think it worked at all. But I wondered if anybody else has tried to do anything about customizing food for patients who have these various problems.
So, yeah, actually, I had a slide. There's a group of chefs that are starting an initiative to develop more flavorful diets for hospitals and for, healthcare facilities, which I totally applaud. I think it can be done. It will take a concerted effort, and it will take recognition that it isn't just adding more of a spice or whatever, but you have to think of the whole, think of it more holistically with texture, variety, color, the whole 9 yards. But you can you can improve the overall perception and overall enjoyment of food that way, for sure.
Oops. Last question.
Karen Regan from NIH. Is anyone doing anything to get dental care covered by insurance? I mean, a lot of elderly people, they can't afford to pay for their teeth.
We're trying to get it into the Affordable Care Act. We're trying to have a dental home and a medical home. It's so difficult. And Medicare does not address gums and teeth. And I have trouble with people who have lost part of their face, and I'm trying to say, this is not just gums and teeth. We need to reconstruct this person. And I have to fight sometimes for 5 years to get things covered for these patients.
I'm sorry, we're going to have to end. We'll have lots of time tomorrow morning or at the very end of the meeting to talk more about this. And it's very fascinating. Thank you very much for your talks and all the good questions.